to the Second Opinion Dentist, delivered by Dr. Bo Gram DDS. Today I want to tell you a story from my experience as a dentist. I received a patient in my office, I believe she was in her early to mid 40s, with severe pain in her upper right jaw. At least that's what she indicated. And it turned out to be true actually. But and it was really bad, and I looked at her, I took an x-ray of course, and I looked at her, examined her teeth, and I could really find nothing, not even a crack. There was no filling in the tooth, in the area. There was no cavities, nothing at the root tip where you normally can see if there's any kind of infection. And then generally patients start saying, yeah, well, I'm not lying, and I'm not the kind of dentist that, believe that when I cannot explain what it is, that is because the patient doesn't lie. Some doctors, some dentists do that, instead of just assuming responsibility for their own limitations. And there's nothing wrong with that. If I can't see anything, I don't think that anybody can see anything, and I'll even ask other dentists. But nobody seemed to come up with a solution. In that case, you just try to, you examine, you knock on the teeth with an instrument to make sure that there's no pain. We call it percussion. If you have an inflammation or infection at the root tip, that will be very painful, and you can actually in that way localize the tooth that is causing the problems. And you try to test the nerve if it's alive, if there's vitality, and that is a bit difficult sometimes to make sure of that, because even if you have real bad pain, it sometimes becomes inconclusive as well. And the only way you can actually really test if there's any kind of life in the tooth nerve is to start drilling. That will and we'll come back to that. So I couldn't even find out what it is, and actually when in case of real severe pain, you can only kind of split people down the middle and say that all we know is that this was from the right side. It can be in the lower jaw, it can be in the upper jaw. In my experience, I've seen that several times, that you can't see anything wrong where people point, and then when you take out, of course logically you treat the things you can see, and then sometimes the pain even in the other jaw goes down and disappears, miraculously almost. And so you can only say that it's in the right side. So I start looking around for any kind of things I could kind of hang my hat on, or my coat, if you like, lab coat that would be. So I couldn't find anything really, and I really want to help her, and I convinced her that I didn't think she was lying at all. I mean, why would I do that? So I start drilling and find out that in her premolar, this last of the small side teeth, if you like, there was no life. I start drilling. I said to her, informed her, and said that I need to do this, and the second you feel any kind of normal pain that you would feel from drilling into a tooth, you react. There was no reaction, so the nerve was dead. I could drill straight in there and she didn't respond to it. So okay, I thought I have actually found the problem, so I start out with a root canal filling on that specific tooth. She came back, still had pain. And now even a hardened dentist starts saying, oh my God, what is this? So I go back, I look at the tooth I had started with, but that seemed to be fine. There was nothing. The initiation of the root canal filling or root canal treatment had actually been successful. Then I start looking around and say, well, she had another tooth, the first big molar, behind the tooth that I have commenced a root canal filling on. And I had to convince this woman that I have to do the same thing again. I'm not sure that there's any vitality in that nerve, so we were back to kind of square one. I started drilling, and I informed her that she should react the second that she felt any pain. She felt nothing, so that nerve was dead as well. Now, I cannot explain what has happened to those teeth. Maybe she fell on a bicycle when she was 6 years old, and she had to be more than 6 actually, since she had a premolar, so she had to be maybe 10, 11 years old. And has forgotten all about this over 30 years, 30 plus years. I don't know today. All I do know is that instead of just going in there and becoming a hero and or just say that it's the patient's fault, they are probably lying, or it's not true, or it's psychological, or whatever. I took it step by step. And in some cases it's not that easy to find out exactly what's wrong. And it takes a bit of convincing when a dentist, at least for me, in my opinion, that you should start drilling into completely, ostensibly perfect, symptom-free tooth with nothing except for the fact that the nerve had somehow died, and I couldn't see anything on X-ray, I couldn't see anything anywhere, and you just had to go and start out that, and you know, I found out, and we started treating these two teeth by removing the nerve. Sad story. I don't know exactly what it is still, but you know, some people would give her an antibiotics, and probably that wouldn't have helped, but I will return to that in another video later on. Or some people just again give her painkillers and send her home, and that's what happens a lot with the doctor as well. And you know, that is symptom treatment and not treatment of the root cause. I cannot explain, but I found the root cause. I found that it was the demise of these two nerves in two seemingly intact teeth that caused her the problem. And finally it's succeeded. She was becoming, and people do that, becoming more and more desperate because the pain persisted, and you know, the expert couldn't find the solution. And that sometimes I think is misdiagnosed as this patient is sometimes has a mental problem, or you know, is in a crisis of the mind rather than of the body. And you know, if you have had pain and you can't get an explanation, you would know that, you know, that makes you a little bit out there, and you don't get any sleep and such. So of course you get stressed. That doesn't mean that the stress is the root cause of your problems, though. And a lot of therapists should keep that in mind. Unfortunately, a lot of therapists, they don't, and that causes problems. So only trust the experts if they make sense, and if they go about their problems generally and explain. And I had to explain to this woman all the time why I was doing what I was doing, and why I couldn't really just pinpoint and just take away her pain in 30 seconds. And I guess that's what made her come back rather than going to another dentist, since I hadn't solved the problem. From her point of view, she come in there, I commenced the root canal treatment, didn't help, the pain came back. Of course you would naturally think that the treatment I had done that hadn't functioned, but that was not the case. So a bit of a detective work actually eventually helped her with her pain. So, not that easy. Subscribe and primarily share this so that a lot of people can start out getting in contact with this whole concept of, you know, second opinion, and not necessarily trusting anything that doesn't make sense to you, anything that doesn't combine with your intuition, at least, especially if you reach experts that cannot stand being questioned. You have to, if you can't be questioned, and that goes for governments or experts or whatever, well then obviously there's a problem. So thank you for this time. See you soon.